And, when I'm teaching students or new clinicians, it's really your whole treatment, your whole, the next however many weeks you're seeing that patient really hinges on making that proper diagnosis. And you mentioned, and we've talked about all these great innovative products, wound imaging and some of these biomarker tests and all this really cool stuff that's coming out. But really, it's your own clinical assessment and wound assessment and being very thorough in that wound and clinic. That's the best tool that clinicians have in their toolbox.
Right. And I would caution all the clinicians against only using drop-down boxes. I think in our rush, it becomes rote, if you will. Drop-down box, drop-down box, drop-down box. And then when you look those notes over, we're missing big key pictures. So for example, I just did some chart reviews with a group, and on their wound assessment, there was literally no description of the tissue in the wound at all. And each note didn't declare its own medical necessity. That's another big component to this, is each note needs to stand alone. And if you're going to submit this, maybe after 3 or 4 graft placements, does each note represent there was a medical necessity and a need on that visit? And then sometimes we kind of accumulate our notes, and you might think it's easier, I'll just do the summary and I'll grab all the notes and send them. But sometimes it's much better to do each note individually, or we're missing key components of what Medicare needs.
No, I think that's a great point too. And the cut and paste and the carryover.
Right.
If you see this patient 10 times and the note is verbatim the same.
Big red flag.
That's a problem.
Big red flag.
Yeah. So